Traditionally, when we talk about mental health, we're talking about things like anxiety, depression, and other more severe mental illnesses. When we talk about behavioral health, we're talking about these mental health issues, and we're also talking about behaviors that affect health. We're talking about behaviors that had led to health conditions such as diabetes, heart disease. We also are talking about behavior change that's necessary to improve our health, such as modifying our diet, reducing alcohol use, smoking cessation, increasing our activity levels, and how do those issues affect our overall health and wellness, and how do they contribute to chronic conditions. Unlike a PhD, which is really focused on doing research for academic purposes, the Doctor of Behavioral Health program is an applied program where students will complete basic research projects in a clinical setting, and the focus of those projects will be either management or clinical, depending on their concentration.
Our program is actually geared to both the triple and the quadruple aims of healthcare.
The triple aim addresses the health of the population, the patient's experience with their healthcare, and reducing the per capita costs of healthcare. Our program addresses that, as well as the quadruple aim, which incorporates the triple aim, plus addresses the provider satisfaction with care and reducing provider burnout. The difference between the management and the clinical concentrations are really two sides to the same coin. The clinicians provide the services and the managers run the programs. When choosing whether to apply to the management concentration or the clinical concentration, you want to think about what your career goals are. For clinicians who want to increase and broaden their clinical skills, the clinical concentration may be more appropriate. For clinicians or managers who really want to move into management of an integrated or whole person care program, the management concentration may be more appropriate. Students will have to complete an internship, whether they're on the clinical concentration or the management concentration, and this internship provides them with an opportunity to apply the skills they are learning in their classes. People often ask, why are behavioral health specialists needed now more than ever? When in reality, they have always been needed, because behavioral choices have always affected our physical health. As a society, we are becoming more and more aware of that aspect of healthcare because we recognize the importance of addressing behavioral health issues if we really want to improve overall health and wellness.
Behavioral health is actually an all-inclusive term that includes our mental health and all of the behaviors that we choose every day that improves our health and well-being, such as putting on a seatbelt or taking our medications or substance use. It incorporates everything that we do every day that we make an active choice to improve our health.